Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor, and I'll be your host today. Our webinar is called Cutting the Child Poverty Rate by Half, and is based on a recent report from the National Academies called A Roadmap to Reducing Child Poverty. We're really fortunate to have two of the report's authors with us today, Hilary Hoynes and Robert Moffitt. So Hoynes is professor of economics and public policy at UC Berkeley, where she holds the Haas Distinguished Chair in Economic Disparities and also co-directs the Berkeley Opportunity Lab. And Moffitt is the Krieger Eisenhower Professor of Economics at Johns Hopkins, and we're happy to note that both of our guests today are longtime affiliates of the Institute for Research on Poverty. So Hilary and Robert, thank you so much for being here today.
Great to be here.
Thank you.
I also want to thank the Office of the Assistant Secretary for Planning and Evaluation for their support of this webinar series. That said, any positions expressed in this webinar are not necessarily those of ASPE, any other agency of the federal government, or the Institute for Research on Poverty. In just a moment here, I'll be turning it over to Robert and Hilary for their presentation, which should take around 45 minutes or so, and after that, they'll take your questions. So make sure to type those into the Q&A box at the bottom of your screen throughout the webinar today, and we'll get to as many as we can before our time's up. So with that, thanks again to both of you for being here, and I believe, Robert, you're going to be starting us off today.
I am indeed. Well, thank you, Dave, and I want to let me say Hilary and I are both very happy to be able to talk about this report today, and especially under the aegis of the Institute for Research on Poverty. The Institute recently celebrated its 50th anniversary, which is pretty amazing, and they spent 50 years sponsoring research on poverty, keeping poverty on the public agenda, sponsoring activities and sponsoring research on the issue. So it's very appropriate, and very happy to be under their sponsorship. The committee report that I'm going to talk about today with Hilary was mandated by Congress, actually, in December 2015. They directed the National Academies to study ways to reduce child poverty by 50% in 10 years, to conduct a comprehensive study and to come up with ideas for how that goal might be achieved. If you don't know, the National Academy of Sciences, and now it's the National Academy of Sciences, Engineering, and Medicine, been renamed. It's an old institution that was established in 1863 by Congress. It's a private, non-governmental institution, and it serves to advise the nation on important issues, mostly commissioned by the federal government and its many agencies. It gathers experts, it issues reports, forms committees, and generally for government sponsors, and issues report. This report is exactly of that type. Congress mandated that the National Academy form a committee of experts to study how to cut child poverty by 50% in 10 years, and it issued a very specific charge, which I'll talk about just in a couple of minutes, and I want to be very clear on what we were asked to do. All National Academy reports are given a very specific charge, a very specific task, and pretty much are delegated to study just that. So that's what we'll be talking about today, and I'm going to talk for a few minutes and then kick it over to Hilary, and we'll each go through our findings. I'll start by just listing the study sponsors. The main one is the U.S. Department of Health and Human Services, listed at the bottom. Congress asked DHHS to actually administer and supervise the study and provide funds for it, but we received a large number of support from other foundations I've listed there on the screen. It was a quite expensive study, mainly because we did hire the Urban Institute to conduct the calculations, and as you'll see from our report, as we go through the actual numbers here, there were a lot of calculations involved. We spent 2 years on this report, and it was a lot of work that was done, and we were very grateful for all the support we had to get as much done as we could. I want to thank the main congresswomen who sponsored the report, Barbara Lee and Lucille Roybal-Allard, who were in the House, and with support across the aisle, were able to get Congress to provide the funding for this study, the very important study, and insisting on studying child poverty and how to reduce it. The committee members are listed here. You may or may not have time to really read the fine print, but there were 15 committee members, and they were drawn from a wide range of disciplines: economists, sociologists, developmental psychologists, pediatricians, policy experts from Washington and from the states. It was also diverse in their views they brought to the table. Both liberal and conservative members were on the committee, so it's quite diverse, and a large number of perspectives were brought to bear. It was an excellent committee, and both Hilary and I greatly enjoyed working on it, and I learned a lot from my fellow committee members. So the statement of tasks, as I said, is very important here. This was given to us in writing, and we were asked to study 3 different things, with the third being the most important. Number 1, we were asked to review the research on linkages between child poverty and child well-being. Does child poverty, growing up in a poor household, does it affect your children, both when they were children and later as adults? We were asked to review that evidence. Number 2, we were asked to look at the current system of transfer programs we have in the United States and ask how much are they reducing poverty? A lot, a little, somewhere in between? Give us some exact numbers on how much the current system reduces poverty. So we'll talk about that. And most important, the third statement of task item was to provide a list of alternative evidence-based policies and programs that could reduce child poverty and deep poverty by 50% within 10 years. So I want to pause a little minute and go through some of these words because every one is important. One is evidence-based. We were asked to use the best evidence that is out there, to not speculate, and to put a very high bar on the evidence for the policies we might come up with. And our committee was very assiduous in not going beyond the evidence as we saw it, as we read it. We spent a lot of time reviewing the evidence and basing our policy list on that. Secondly, I want to point out that it says provide a list of alternative policies. It does not say recommend policies. In fact, our report doesn't recommend policies. We were asked to simply calculate and discover and provide a list of policies that could achieve this very important goal of reducing poverty, child poverty by 50% within 10 years. We were not asked to recommend things. So we have a list, and we were able to find some policies that we calculated would do that and achieve that goal. And it's up to Congress, the President, and our voters to decide which, if any of those policies they would like. But we were not in the business of recommending things. We were in the business of doing calculations and providing a list. And finally, I just want to say right here, because it always comes up as a question, 50% within 10 years, that is a very, very short period, 10 years. It's almost like tomorrow because programs take time to implement and to set up and operationalize. One thing that implicitly rules out is any program that is devoted to children below, say, age 15, and certainly programs for early child education and K to 12. Why? Because those programs are long-run programs which have impacts way down the line and farther than 10 years. And we joke that we really should have another committee and another report to discuss the policies that are so talked about today and so important for those long-run impacts. So we were not going to be talking about those kinds of policies, and our committee was asked to consider only short-run, what I would call short-run policies. So those are all very important things to keep in mind, and you'll see their implications as we go through the report. So we're going to talk about each of those 3 tasks that we were asked to study and what we found on each. So I'll start off with number 1, and Hilary will pick up with number 2. Number 1 was, what is the evidence on the impact of poverty on child well-being? Well, we reviewed a lot of research. If you do look at our report, Chapter 3, we have an entire chapter devoting to that review, going through study by study. And we did impose a very high bar on the rigorousness and the quality of the research that we wanted to count as evidence for or against this proposition. That meant a lot of RCT evidence, randomized controlled trials, as well as a lot of very credible, very strong, high-quality design, non-experimental research that used careful natural experiments and quasi-experiments to assess the effect of child poverty. Our review revealed there were at least 3 findings from that literature which were very credible. One was that growing up in a poor household has a number of negative effects on children while they were children, both on birth weight at the time of birth, brain development, and various aspects of health, both physical and mental. Secondly, we found the evidence, very strong evidence, that having grown up in a poor household affects adult outcomes in a negative way. Fewer years of education, less likely to go to college, lower employment rates, and lower earnings when you're an adult. And third, we thought the evidence was clearly strong that the younger the child is when poverty occurs, the worse the effects, both the effects while a child as well as the effects later as adults. So 3 important findings. We did also find some studies that tried to put a dollar cost on child poverty, and it was a big number when we reviewed the studies, $800 million to $1.1 trillion, about 4% of GDP. That all comes from the lost earnings, the lower employment, the increased cost of health care, the cost of incarceration, and the cost of assistance programs. It's a very big number, and it should be kept in mind as we talk about the cost of new programs later, because this is a very big number that we would certainly all prefer to reduce. So the final part of this chapter was to look at whether programs we have right now have had any negative effect on those deleterious effects. That is to say, that any of our programs reduce those effects and help children. And we found, again, very credible evidence for at least a minimum 3 programs. And SNAP, which is our food stamp program, the Earned Income Tax Credit, and public health insurance, primarily Medicaid, have been shown through rigorous studies to actually improve child outcomes, both cognitive and non-cognitive, and also long-run studies which show these programs assist children after they become adolescents and then later adults. So that was a very important finding as well, and led us to go ahead and pursue programs which would reduce child poverty and reduce these negative outcomes. So let me turn it over to Hilary, who's going to talk about the poverty-reducing effects of our major existing programs. Hilary?
Thanks, Robert. So Robert has set the table nicely with reminding you all and informing you about what our statement of task is. Before we come back to these programs and how we might expand or introduce them to reach our goal of 50% reduction in child poverty, the second major element of our statement of task was to analyze the existing programs that we have in the United States, both transfer programs and tax programs that are aimed at reducing child poverty. And so to do so, we're going to be showing you some results using the supplemental poverty measure. The supplemental poverty measure is part of our statement of task to be the definition that we will be using for measuring child poverty and the effectiveness of the current social safety net. So a child is defined as being poor if they live in a household whose after-tax and transfer income is below a defined poverty line, which is defined in this supplemental poverty measure. The resource measure for calculating child poverty in the supplemental poverty measure includes all cash income. It also includes in-kind resources such as food stamps and others, housing vouchers, and also is an after-tax measure. So critically includes reducing resources due to things such as payroll taxes, which are very high for low-income families, and critically, as you'll see in just a second, the addition of resources through the Earned Income Tax Credit and the Child Tax Credit. So with that definition of child poverty, in 2015, using our model from the TRIM-3 Urban Institute model, we find that 13% of children in the United States lived in families with income below the poverty line. So 2 things I want to add to that to flesh that out a little bit. Number 1, Robert mentioned that we contracted with the Urban Institute to use their TRIM-3 model to allow us to both calculate the effects of the current social safety net and to simulate changes to that social safety net. The TRIM-3 model makes adjustments for undercounting of transfers that we now see showing up to a large extent in our government surveys. So it's a very important feature of our estimates that they account for the underreporting of transfers. A second element to point out about this 13% is that it is based, as I mentioned, on the supplemental poverty measure, not the so-called official poverty measure in the United States. And to give you an idea about the magnitude of that poverty line, in 2017, if you were a two-adult, two-child family who rented, the poverty line would be about $27,000 per year. And that poverty line is adjusted for differences in family size, as well as differences in housing costs at the local area to make adjustments to the needs. So the 13% of children poor adds up to a little under 10 million children who were poor in the United States in 2015. We also, as per our statement of task, are studying deep poverty. So deep poverty is defined as having income below 50% of the same federal poverty line. So in 2015, the estimates show that 2.9% of children, or about 2 million children, live in families that are in deep poverty in the United States. So that's our baseline setup. So then we take that 13%, which you can see at the top of this graph, and then with the trim-free model, we ask the question, what would happen if we eliminated a given program that is currently part of the U.S. social safety net, such as you can see on the list, the Earned Income Tax Credit, food stamps, etc. Now, each of those simulations where we simulate eliminating one of these programs one at a time is under it's what we call a static assumption, and that is we zero out that program assuming nothing else changes in the household, no changes in employment or earnings or family composition. We'll come back to that when we talk about our simulations of changes in policies. But for the calculations I'm about ready to show you, it's a simple static calculation that relies again on this trim-free model. So if we simulate eliminating these different elements of the social safety net, what we see is that the most important program for reducing child poverty in the United States are our tax credits, the Earned Income Tax Credit and the Child Tax Credit, in particular the refundable part of the Child Tax Credit, which is known as the Additional Child Tax Credit. Together, those two programs eliminating them would increase child poverty by 5.9 percentage points, or raise the poverty rate from 13 up to 18.9 percentage points. The second most important anti-poverty program is food stamps, or SNAP. That would increase child poverty by 5.2 percentage points off that 13% base. And interestingly, Social Security, because of three-generation households and some survivors' benefits, is the third most important anti-poverty program for children in the United States. So we do the same calculation for deep poverty. So as I mentioned, under the current law, 2.9% of children live in families that are in deep poverty. The second bar on this graph, which I neglected to mention on the last slide, simulates eliminating all these programs together. And as you can see, the child deep poverty rate would increase by almost fourfold with all these programs eliminated. Looking at the programs one at a time, you can see that deep poverty, having income below 50% of poverty, food stamps is by far the most important program for keeping children out of deep poverty. The tax credits, which are the most important for poverty, tend to be targeting a population that has slightly higher incomes because of its requirement to have earned income. And so we see that the tax credits are less effective in terms of reducing deep poverty. And this is going to be a really important thing to point out when I hand things back to Robert in just one slide, when we talk about options for our reducing child poverty and deep poverty as per our statement of task. Let me just mention one more thing on this slide before handing it back to Robert, and that is you might be wondering what that last category is, other benefits. So other benefits includes TANF, veterans assistance, educational benefits, energy assistance, and other food and nutrition programs, school lunch, and the WIC program. So those are all bundled together in those other benefits. So with that, I'm going to pass it back to Robert to talk about our third section of the report on policies and program options for child poverty reduction.
Okay, thanks, Hilary. So this is the third task that was in our statement of task, and the most important one, to search for programs and policies that could reduce child poverty by 50% very quickly, as I said before, within 10 years. So that's what we're going to talk about in this section. Let me just say here, the slide says we came up with 20 individual policy options and 4 packages. But let me just say a bit about how we came up with these. The committee drew upon its own expertise and discussed alternative policies among itself extensively, but we also drew on outside evidence. We had 35 different experts write memos to us suggesting programs and policies that they thought would have a significant impact on child poverty and for which there was strong evidence. Remember, that had to be one of our criteria. Was there strong evidence that a program would reduce child poverty? Secondly, we had one public session where we had people come present their ideas to us, and we had attendees who asked questions and discussed the pros and cons. And we also just used our general knowledge of what others had proposed. So we spent a lot of time on these policy options. The 20 individual policy and program options are really only 10, because for each of the 10 we chose, and I'll show them in 1 second, we chose both a high and more generous level of expansion and a lower one to see how sensitive the child poverty impacts were to the level of generosity of the program and not just the program itself. So with that, let me give you this very complicated slide that lists those 10 options. As I said, each one we had a high and generous option and a lower one. We grouped them into categories because right off the bat we realized that we wanted to explore a wide variety of different options. The ones in the box to the upper left there, which you can see is labeled program and policies options tied to work, includes expanding the income tax credit. We know that's a very important pro-work program, which has had, the evidence shows very clearly in the past, it has had positive impacts on employment, and we propose to expand that and make it more generous. Secondly, child care subsidies. Right now, our child care subsidies that we have available to low-income families are very limited. Many families can't get them, and they can't work because of that. There have been many proposals out there, different ways to expand child care subsidies, so we included that in our list. Raising the minimum wage is another way to improve employment if you draw families into the labor force, because now they have a higher wage that makes it worth working, and it also increases the earnings of people already working by raising that hourly wage rate and therefore possibly raising their total incomes above the poverty line. We also wanted to try a human capital program that we thought could be done fast enough, but it's for adults. It's called Work Advance. And there's a very large body of literature on alternative employment programs out there. This one is particularly powerful. It's been evaluated by the Manpower Administration Research Corporation of Washington and had very strong positive impacts on the earnings. So I'll be happy to talk with you and more about the specifics of that. We also tested 2 programs related, well, a high and a low version of immigrants' access. And I should say here that, again, we are not recommending any policies here. We were trying things out to calculate their impacts on poverty, and whether Congress and our public wants to approve them and implement them is not our charge. But there's been a lot of discussion of the impact of immigrants' restricted access on U.S. poverty rates. Right now, there are 2 forms of restriction. One is that authorized or legal immigrants often are not eligible for many of the programs because of past legislation passed by Congress They have to often have long waiting periods of several years. And secondly, of course, unauthorized immigrants are typically not eligible for programs. So we said, well, let's find out what impact that would have on the poverty rate. And then we have modifications to other programs. Now, these are all existing programs that are pretty broad-based. There's the SNAP program. Right now, many families run out of SNAP benefits before the end of the month. The benefit levels in the SNAP program are rather low, and there are a number of things we propose to expand that. Housing choice voucher program. We have a crisis of affordable housing in this country, especially on the coast, and even more on the West Coast than on the East Coast, with many poor families spending more than 50%, possibly 60% of their incomes on housing. And yet our housing programs right now are rationed. They're limited. People spend years on the waiting list, and we propose to expand that to assist people with affordable housing and raise them above the poverty line. It's a supplemental security income. There are many children who are disabled, and their families struggle to support them and provide the necessary services for those children. So we proposed expanding SSI levels. And then policies used in other countries. These are the things the U.S. has not had. One of them is called the child tax credit, which is something like a child allowance. It's not, we didn't quite simulate a pure universal one. It is phased out between 300% and 4% of the poverty line, so around $60,000, $70,000 it gets phased out, so it doesn't go to everyone. But it's a child tax credit which is given to each child per family, regardless of their earnings. And so it's fairly universal. It's been very popular in other countries, and Canada just enacted one which is having a big impact on their poverty rate. And finally, a child support assurance program. Right now, single mothers often do not get child support from the absent father. Many countries in Europe say the government will step in, and if the absent father is not providing any support or not enough, the government will provide a minimum child support to the mother and her children so that they can make themselves viable and afford the food, clothing, and housing that they need. Okay, so those are the programs. And so one finding here is that if we took each of these programs and we took at least the levels of benefits that we chose, we have in our report a very extensive discussion of the levels we chose for each of these programs. You'll see that none of them got to a 50% goal. The 50% goal is this vertical line there, which shows how much you would need to reduce poverty to get to 50%. That doesn't mean that some of them didn't have major impacts. This one, for example, the child allowance, a more generous version of that, had a 5.3 percentage point reduction. Hilary said that the poverty rate is 13% right now, so we're looking for a 6.5 reduction to get all the way to 50%. That did pretty well. That gets very close. The less generous version did 3.4% point reduction. The housing voucher program, that one basically tried to make vouchers available to all eligible families. 3 percentage point reduction in poverty rate from that. 2.1% for the less generous version of housing vouchers. The SNAP reforms, expanding that program, reduced poverty by 1.7 to 2.3 percentage points, and our more generous EITC reduced the poverty rate by 2.1%. So these are nothing to be sneezed at. These are very important reductions. They didn't achieve the 50% goal, but they're all very viable alternatives that Congress and the public may wish to draw on. So that's a set of findings there. What else did we look at? We looked at the cost, and this is probably not surprising to anyone, but the horizontal axis shows how many millions of children were lifted above poverty, and the vertical axis shows the cost, and all these dots are all our programs. And what it shows clearly is that the more children you reduce, the pull out of poverty, the more costly it is. That child allowance, the one that had the biggest impact, about 5 percentage points reduction, cost the most. So programs that are cheaper have non-trivial impacts, but this is something for the Congress and the society to decide how much they want to spend and how far do they want to go, where do they want to locate along this line. So that's one point. And then finally, I want to discuss a very important aspect of our calculations, and that is that we did actually calculate the impact of these programs on employment. And all economists know that there's a very large body of research on whether programs like these increase employment, decrease employment, whether they have work incentives or work disincentives. We reviewed that research literature extensively, and we used the estimates from that literature and plugged them into these calculations to see what impact these programs would have on employment. And we found, as all experts know who follow this research, that some programs increase employment and others decrease employment. A number of the programs decreased employment, which meant that typically women, single mothers, for example, with young children who were working only because they had no the money to support themselves, if they were allowed to have some housing subsidies and food stamp subsidies and some of the other programs, they would take time off and spend time at home with their children. That's what the literature shows, and we calculated that. At the same time, these other programs we looked at, which were provided work incentives and provide more money to workers, also increased employment. Those increased employment by about 550,000 workers. So we'll come back to this when we look at these so-called packages that Hilary will talk about. But this was a unique part of our study, and we actually were giving numbers to Congress and the public here, so we don't have to speculate about what the effects might be. So with that, I'm going to move along here and hand it back to Hilary, who's going to talk about our decision then to combine these policies and programs into so-called packages. Hilary?
Thanks, Robert. So as you just saw on the prior graph, the policies that we simulated individually, the Earned Income Tax Credit, expanding food stamps, the new child allowance, they all reduce child poverty, and some by quite a bit, but none of them alone got us to our statement of task of a 50% reduction in child poverty and child deep poverty. And so one of the things that we did as a committee was to set aside, come up with a list of goals that we have for these programs and policies. And this sort of got us to the point of creating these packages. So as Robert pointed out, some programs tend to be focused on topping up earnings and incentivizing work, such as the Earned Income Tax Credit and the child care subsidies. Other programs tend to provide sort of protection or safety net protection in the times that individuals are unable to be working. So we're trying to balance in meeting our statement of task issues around, number one, meeting the poverty reduction goals. Number two, cost. These are not in order. They're just elements of our goals. Number three, the desire to promote work, and also the desire to create protection for those who in some periods of time don't have earnings. And so we combined these packages, we created these packages in order to take into account different weighting of these different goals, which some are in opposition to one another. And so in doing so, we, as is pointed out, note that sometimes people need work support, sometimes they need housing support, sometimes they need cash assistance, and these multiple programs or packages might be much better suited for meeting our statement of task and meeting household needs than using just one policy. And so just to add one more thing on the technical elements of our simulations with the TRIM3 model to add on to what Robert mentioned, he was talking about our simulations for the impacts on employment. The numbers that I'm about ready to show you that show the effects of these packages on poverty rates take into account these behavioral adjustments. So it is the net effect of expanding these programs and the increase in resources that that delivers to households, in addition to the impact that operates through earnings, either more earnings, for example, in the case of an expansion of the Earned Income Tax Credit, or less earnings, for example, in the addition of a child allowance. So these are behavioral effects included in the simulation that I'm going to show you. So we came up with 4 different packages, and you're going to see them filling out this table in the next slide. So the first package is what we called the work-oriented package, and we took all of these policies that Robert just outlined and said, how much poverty reduction can we get by focusing only on policies that are tied to work? And those 4 policies are, number 1, expanding the earned income tax credit. Number 2, expanding this child and dependent care tax credit. So the first 2 are tax credits. The third, expanding the minimum wage. And the fourth was this human capital program aimed at adults that can deliver short-run benefits that Robert mentioned. And so what you can see from the first column is that implementing those 4 policies reduced child poverty by a little less than 20%, and also deep poverty by the same, about the same amount. So you can see that here in the bottom of this table. You can also see that a policy that is oriented towards work packages, as I just described, leads to about 1 million new workers at a cost of about $9 billion. And so this is a great illustration of what we can do with a work-only package, but as you can see, it doesn't get us to the 50%. So we moved on to showing 3 different packages, and I'm going to talk first about the second column, the work-based and universal support package, and then I will finish with the final 2 columns. So in the second column, we took the 2 most effective anti-poverty programs that are tied to work, the expansion of the earned income tax credit and the expansion of child and dependent care tax credit, and added to it a child allowance, and it was the less generous of the 2 child allowances that we considered and Robert presented on the prior page. And the idea was to balance this in-work support with some support that extended to folks who were also out of work, as the child allowance does. And we chose those packages because those were the packages, those 3 programs together in one package, because they delivered sort of the most poverty reduction sort of per dollar of spending. And what you can see is that those policies get close, but not quite all the way to reducing poverty by 50% and deep poverty by 50%. The cost is up to $44.5 billion. Adding that child allowance is the main element of that change in cost from the first package. And you can see that adding a child allowance, as Robert mentioned, does discourage some work, moves some people out of the labor market, so that $1 million in additional jobs is reduced somewhat. But still, the net effect of the package is to increase the number of workers, while doing poverty reduction by 568,000 jobs. Finally, in the last 2 packages, we have 2 different options that each get us to poverty reduction of 50% as per the statement of task. The difference between the 2 packages are the third one, the one that's entitled Means-Tested Supports and Work Package. That one relies on existing programs to expand assistance, housing vouchers, and food stamps, while the 4th program uses this new program of a child allowance to expand assistance outside that simply conditioned on work, as well as you can see, adding this new child support assurance program and expanding, rolling back some of the restrictions on access to the social safety net by legal immigrants. And what you can see there with those 2 packages is they each reach our 50% poverty reduction. They each increase the number of employed individuals by 400,000 for the means-tested supports and a little over 600,000 for the, quote, universal supports package. And you can see that each of them cost about between 90 and $110 billion. So before passing it back to Robert, let me just kind of finish with a few things about these packages. So as Robert had mentioned earlier, we have these estimates about the cost of child poverty. So while these packages that achieve the 50% reduction in poverty add up to real costs, $110 billion on the high end, one needs to bear in mind that the cost of child poverty itself is, by all available estimates, much, much larger than that. So that's the first point to keep in mind. The second point to keep in mind is that individual policy and program changes are not sufficient to meet the 50% goal. There's no single program that's going to get us there. But combining work-oriented packages, policies like the Earned Income Tax Credit and Child Care Assistance with income support programs together can reduce poverty and increase employment. And then finally, a 50% reduction in child poverty is not outside the realm of experiences for our own country or other countries. So the UK cut its child poverty rate by half in a big push set of policies in the early 2000s. As Robert mentioned, the Trudeau government came in and created this new child benefit, which is similar in many ways to our what we're calling a child allowance in our simulations. And we just got the first year of evidence from that policy, and they look very well on track to cut child poverty in half from this one program expansion, one program introduction. And the United States itself, through the expansion of many of these programs which we've talked about over the last 20 minutes, itself reduced child poverty by 50% between 1967 and 2016. So with that, I'm going to pass it back to Robert to talk about some of the issues around the context for child poverty reduction.
Okay, well, thanks, Hilary. And with Hilary, I am eager to get to the Q&A. So with your permission, I think I'll just run through the rest of the slides myself quickly. So one thing is context. We have an entire chapter, if you're interested, please read it, on the ground level view of how these programs work in neighborhoods with real families. And we emphasized in this chapter that there are many, many what we call contextual factors that determine whether those programs work the way they want to. Families, for example, have very unstable and unpredictable incomes. They need support very quickly. That doesn't always happen. They can't always access the programs as much as they should. There are difficulties, both race and ethnic groups, in taking advantage of some of these employment programs. You have to have employers hire you. The same thing in the criminal justice system, where people who have been incarcerated have difficult times getting jobs. Those can impede the employment-producing programs we discussed. Neighborhood impacts are very important. Networks in making these programs work, and of course, health and well-being is always important for being able to work and take advantage of the programs that we've outlined, and really any programs. So those are all very important to mention. And please read our chapter if you'd like to discuss those more. We have another chapter discussing all the programs we did not simulate the effects of, programs which many people have advocated for. Long-run, long-acting reversible contraceptives are one. Mandatory work programs are another one. The promoting marriage is another one. We examined the evidence extensively for all three of these programs, and we did not find the evidence sufficient for any of these three to act on them right now. Evidence may come in the future, but right now we did not think it was there. We also did not do anything on Medicaid. We can discuss that in the Q&A. It's not incorporated in the current poverty line conducted by the Census Bureau, and we had some proposals for how to change that. We didn't have any good evidence on policies for Native Americans, and we had quite a long session discussing TANF, whether that should be reversed or extended, and we didn't think the evidence was strong to do anything on that score either. And so we ended with some research priorities. We advocated a lot of research by the federal government sponsored to evaluate some of these programs that we don't have good enough evidence for, more research on those contextual impediments to taking advantage of these programs, and measurement of poverty is always an important issue, and we had a lot of discussion on things to talk about and research on that and how to improve our measurement there. And finally, next steps, we want to encourage all levels of government, federal, state, and local, to build upon the report, use the report as a jumping off place to look for things they can do to reduce child poverty and establish new initiatives, and also for all levels of government to assist in new data collection on poverty and to assist in the research evaluation projects to increase our knowledge base and search for even better policies and programs. So let me end there. Thank you. These are the study directors, and this is the URL for the report. I only want to mention one little bullet. Last thing here is that we have on our website state-specific impacts of all these programs. So if you want to look up your state, see what those programs do, your state's poverty rate, please check that out. Thank you very much.
Thank you so much, Robert and Hilary. And just as a reminder, we've got a lot of folks that are submitting questions in the Q&A box, but get those in, and we've got about 15 minutes left. And so as the first question, I think, links up to that next step slide that the two of you had, and it's about this question of what does this look like for state and local governments? You know, you talked about kind of experimenting with other programs or looking at initiatives to do this, but what guidance would you offer, or do you think that this report might offer them as they look at those efforts? And Hilary, do you want to start us off with that one?
Sure. So everything that we simulated in our report was simulating federal policies, the federal earned income tax credit and the food stamps and so on. But many of the lessons that I think that our simulations show provide opportunities for states to take action today. So just to mention a few of those, many states, I think 28 now, have state earned income tax credits that sort of add on to the federal credit. So one obvious opportunity for states who are interested in doing what they can right now to reduce child poverty would be to expand or introduce, if they don't have one, a state earned income tax credit. So that's one possibility. Another possibility is both child care subsidies and housing vouchers. While a lot of those programs are funded federally, states have scope to, and different housing voucher district areas have scope to expand access to these programs within the state level using state resources. So those are two possibilities. Obviously, states and local areas are expanding minimum wages. They'll need to use federal instruments to do that. And then finally, TANF, cash welfare benefits through TANF, are very limited in many states in the United States. And so there's a lot of opportunity to use more of the block grant towards trying to do poverty reduction rather than some of the other kinds of activities that the TANF block grant is funding in many states.
Robert, did you have anything you wanted to add to that?
No, that's a very good summary of many things states can do.
Okay. We have a question. Just looking at these large-scale costs and sort of benefit figures, do they factor in sort of additional tax revenue, additional benefits? Just like how expansive are they? Can you give us a picture of that, what that looks like? And Robert, do you want to take that one first?
Well, we did certainly calculate additional taxes for any of the employment programs that were that we enacted, the child tax care credit, the child dependent care tax credit, the child care subsidy program, basically, the earned income tax credit. Those do generate taxes. Now, those mainly had an impact be honest, on our poverty rate calculations, because people who work also have to pay taxes, and the supplemental poverty line measure, that's the preferred measure for most analysts these days, does consider only after-tax income. But we did not calculate, I think the question is, when we calculated costs of the programs, did we calculate the increased tax revenues in those costs? And the answer is no. Those costs are simply the cost of benefits paid out to the recipients of these programs that we proposed.
Hilary, did you have anything you wanted to add there?
Yeah, just to point out, just to kind of give the questioner a little bit of a sense of how this works in the TRIM 3 model. So suppose you expand the earned income tax credit. As Robert discussed, we build in from the existing evidence what we would expect to change in terms of the number of people working and how much work individuals are doing. So the earned income tax credit goes up. We know that means from the research that more individuals are working, so there's more earnings in the household. So then in a very mechanical way, that increase in earnings is filtered through the rest of the TRIM 3 calculator. So for example, if my earnings go up, my SNAP benefit's going to go down. If my earnings go up, I may or may not pay more taxes, depending on exactly how high my earnings are. And so that's the way in which the total effects on poverty do filter through these other programs. So they are incorporating the whole concept. That's one of the huge advantages of the TRIM 3 model, is it allows us to adjust the amount of benefits that individuals are getting as their economic circumstances change. So it's a real, there's a lot sort of to unpack in those poverty reduction measures.
Okay. I think we have a related question that asks about how we might model things in a much longer outlook here. I mean, so what are sort of the long-term benefits of reducing child poverty, and is there really a way we can measure that and kind of understand what that might look like, not just 10 years from now, but 20 or 30? And do you have a sense of what you might tell us about that? Robert, do you want to start us off there?
Well, we've gotten that question several times, and we really didn't have the time or resources to try to make that calculation. As I discussed at the beginning, we do know that many of these programs do improve child outcomes and help children. The SNAP, if you remember, the Earned Income Tax Credit, and Medicaid all have been shown to have positive impacts. It's a good question to ask whether those impacts would reduce those enormous costs, $800 million to $1.1 trillion that we assessed in the beginning. We do know that earnings go up for children who have been raised out of poverty later, and employment's increased, and one could calculate the dollar a payoff to that. But that would be really a separate exercise that I would think would be very interesting to do, and it would be nice, in fact, when we're recommending our next steps here, if that could actually be quantified and measured. So it's a very good question, and I hope we can get to answering that quantitatively in the future.
Okay. Hilary, did you have anything you wanted to add there?
No, that sounds great.
Okay. So we have a question from Laura asking about, so we saw what these packages do for child poverty. What do they do for overall poverty? Did you look at that?
So this is Hilary. No, we did not look at that anywhere. So we were very structured by our statement of task, and so our statement of task was about child poverty. And our statement of task was not about about poverty overall. So we have no calculations about how this would affect poverty more generally. One could certainly think through sort of qualitatively which policies that we simulated would be more likely to also affect other parts of the population, say elderly individuals, people without children, and disabled individuals might be sort of three other kind of groups of individuals. And of course then the parents in the households where these children are. And I think the poverty measures give us a sense of that already. So I think one could think through those effects across those different groups, but it's not anything that we have any actual numbers to put to those thoughts in the report.
Okay. Robert,
yeah, I'd like to add on that. The fact we bumped up against that question several times because we know the poverty rates are not zero among single, childless individuals
right.
and married couples without children. In fact,
right.
We all discussed at length the fact that childless poverty, that is to say poverty among singles and married couples without children, is rising, and the millions of families are in that category, and they need programs. They may not be quite the same programs as the ones we proposed here. So we bumped up against it, kind of regrettably, saying we couldn't address it. But it's a very important topic, and I hope that we or others can move forward with some concrete similar proposals for families without children and how to reduce their poverty rates.
And just to add on to one more thing to that, very centrally among those adults who are, quote, childless, many of them are not childless. They're non-custodial parents. And one of the things that we talked a lot about in the report is, and we were just limited by the data in order to do something more with this, is to ask the question, if you increase the resources of non-custodial parents, how would that translate into reductions in child poverty? And it's just in our data, the non-custodial parents are not connected to the children. So there was just no way for us to do that. But it was something that we talked a lot about, not just, as Robert mentioned, about the vulnerability of these other groups, but the fact that many of these other groups are actually connected to children. But it just was a kind of technical aspect of the exercise that we couldn't do.
Okay. We have a couple of questions, just asking for a little bit more detail about the policies in Canada and the UK that you referenced. How similar do those look to the packages that you're talking about here? And Hilary, do you want to start us off there?
Sure. So let me talk about the Canadian child benefit. So essentially what Canada implemented is something that is sort of similar to our child allowance, but much more generous. So if I remember the numbers correctly, it's something like 6,000 Canadian dollars per child, with a higher benefit if the kid is under age 6, I believe, than if the kid is over age 6. And that benefit is unconditional in the sense that you get it if you have 0 earnings, you get it if you have $10,000 in earnings, though it is phased out, I think, between, Robert, you correct me if I'm wrong, 300 and 400% of poverty, something like that. So households get that 6,000 Canadian dollars up until the point that their income is around 60,000 Canadian dollars, and then it's sort of very gradually phased out. And so the difference between that and what we're proposing, I would say, is mostly a matter of scale. It's bigger than our child allowance. So the largest child allowance that we simulated was $2,700 per year, or maybe $3,000 per year, US dollars. And so the Canadian child benefit, the program that is already showing results towards getting towards a 50% reduction, was essentially a much bigger version of something that was one of our simulations.
And if I can add, the UK, basically under Tony Blair, who actually declared a 50% reduction in poverty to be explicit government goal, achieved that 50% reduction by a very comprehensive umbrella war on, quote-unquote, war on poverty they conducted, which increased both cash benefits, but also major increases in employment-related programs, child care programs. They had a version of the EITC, which went under a different name, and they actually achieved that reduction. I should say that the UK has now reversed course, and since 2010, they've been retrenching and going backwards from where Tony Blair had moved the country, and I believe their child poverty rates have been rising, which just shows that you have to have a sustained effort. And I hope that in the United States we can start that effort and sustain it and keep it going and starting to reduce our child poverty rates.
Okay. So we are just about out of time here, but I want to give each of you an opportunity to kind of give us some parting thoughts. What things are you looking towards in the coming years, or just what should our takeaways be here? And Robert, would you start us off there?
Sure, I'll be brief. I view our report as a good jumping off place. It's a starting point for the conversation. We have actual numbers, we have actual programs, but none of those things have to be taken literally exactly in the same form they are or with the exact same benefit levels. They're ideas of a whole range of programs which either together or separately could have a major impact on child poverty. I think it's up to Congress and those at the federal level, but also very importantly those at the state and local level to think about what will work in their communities and to adopt various versions of what will work best for their poor families and to really re-engage this very important social issue and move us forward to the benefit of all these families and especially the children who will grow up to be productive adults and assist our economy and society.
Okay. Hilary?
Geez, hard to improve on that. Let me just add a few things, and that is, it was such an honor to be able to serve on this committee and to serve with Robert in particular. And one of the things that the National Academies really holds us to, just to end with this, is the importance of making, evidence-based policy simulations in our case. So our hands were very tied with respect to what exactly we could present as alternatives for reducing child poverty. And so that evidence base is really strong and provides some really good signposts for where we want to go for trying to meet this goal, which is clearly by our simulations very achievable. And I want to sort of put another plug in for continuing to do this work that shows not only how these programs mechanically reduce poverty, but the implications of the reduction in poverty for the child's life course, which hopefully will be the next National Academies report on this important issue.
Okay. Well, Hilary and Robert, thank you so much for this wonderful, really helpful presentation today. I'm just grateful that you were able to do this.